This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Hello.
Hi there.
You guys see me? Hey. Thank you for having me. I'm Dr. Siegel. I'm the PD at Moss. I'm just going to start sharing my screen here. Okay. Now I can't see any of you anymore, but that's okay. I'm going to try to keep this relatively brief to leave lots of time for question and answer because there's just so much stuff to talk about. I'm not sure, how much to give you in the presentation and how much to just let it be informal. So, I'm Miriam Siegel. I'm the relatively new program director at MossRehab's PM&R program. The reason why I say relatively new is because I've been the brain injury medicine fellowship director for 7 years now, and just took the residency program up a couple months ago. So MossRehab, just have to at least acknowledge the history of rehabilitation medicine at Moss, which goes back 100 years. The Moss residency program had been affiliated with Temple for a long time, upwards of 50 years, in fact. A lot of the attendings at Moss actually graduated from that program, and we're kind of parting ways a little bit. So we continue to train Moss residents, Moss Temple residents, but they're being phased out. So we have PGY4s that are Temple Moss residents, and then our 2s and 3s this year are straight up Moss residents, not from Temple. They are our own. So this program, which I'm speaking to you about today, was ACGME accredited 3 years ago and had PGY2s matriculating last year for the first time. But we've been training residents at Moss for 50 years. As a rehab hospital, we're highly ranked in the nation. We got to number 6 this year. We're top ranked in PA. And we have just a lot of faculty that are well known in the field. People that have trained at MossRehab have been presidents of AAPM&R and ACRM, academic chairs, program directors. But this is what I'm the most proud of. These are our current residents. So these are our newly minted PGY2s, and this is orientation here. And these are our newly minted PGY3s. And these guys are just great. It's been such a blast. They've so far exceeded my expectations. This is me, and I'll tell you guys a little bit about myself. I actually, it's so funny that Burke went right before me. I actually trained at Monty. That's where I did my residency. I finished up there in 2006. I actually stayed there for a year post-residency because I liked it so much. And then I did a fellowship at JFK in brain injury medicine. And then I went on to start a brain injury program, a clinical program at University of Pennsylvania. And I was there for a few years before I was recruited to Moss. And I've been at Moss since 2011, and I absolutely love it there. I love the people. I love the work. And like I said before, 7 years ago, I started the Brain Injury Medicine Fellowship, which has been really successful and really fun. This is Dr. Jacqueline Barsakowski. She works with me as associate program director and best bud at work. And Casey Washiaki is our program coordinator. I'm not going to read you our program mission. I'm guessing that you're going to have access to these slides. But when I took this program over 2 months ago, I actually rewrote this mission because I really wanted it to, really say what I wanted it to say, and that is that, our main goal is to make sure that when you finish residency, you're ready. You're ready to practice and be a well-rounded physiatrist. And whether you choose to do a fellowship or not, like you're ready to hit the ground running and meet whatever challenges come your way as far as physiatric practice. But we also want to give you a chance to explore your passions within physiatry and develop your interests. And so my goal is to strike that balance. And I think that we have all the resources to do that successfully. So at Moss, there's some special features that we have here that other, programs may not have. There's the MossRehab Research Institute, which I'll talk a little bit more about a couple slides later. We are a TBI model systems. What that means is that we have a large volume of TBI patients coming in, that we're meeting certain standards as far as the quality of care for persons with brain injury, and that we also do advocacy work for brain injury and research, and that we recruit to the patients to the Traumatic Brain Injury Model Systems Research Registry. We also have a gait and a motor control analysis lab. So those are really neat resources. And I'll show you a little video of a resident commenting on their experiences in the gait lab. We treat a lot of patients with intrathecal therapies, mostly baclofen. And we also recently inaugurated the MossRehab Institute for Brain Health, which is an intensive 3-week residential program for patients with brain injury that are veterans or first responders. Pretty unique program. I had a video in here. Oh, here we go. All right, this is a quick one.
The teaching I received here is from physicians that have unparalleled experience in their field and have access to resources that I haven't seen anywhere else. I've also had the privilege of working in the gait lab a couple days a week for multiple months with Dr. Moon right now, and this has been eye-opening as to what goes into a full gait evaluation. Aspects I had no idea existed and can help us pick up on the minute details that you don't get to see without this type of equipment and experience working with it.
I couldn't have said that better myself, so I had to put that video in there. These are the fellowship programs that we offer at Moss. The ACGME accredited program is the brain injury program, but then there are other non-ACGME fellowships that we do offer, and these are really neat. There's a gait movement evaluation and spasticity or prosthetics and orthotics course. That's like a mouthful. That is a course, a fellowship year of training that's run by Dr. Esquenazi. There's a sports and spine program that is run by Dr. Chris Plesteris, and EMG. These are the sites of training. The hub is really MossRehab Hospital at Elkins Park, which is now a freestanding rehab hospital with multiple subspecialty services such as brain and spinal cord injury and stroke. There is another inpatient unit at MossRehab at Tabor Road, which is at Einstein, Philadelphia, which is the main campus of Einstein Medical Center. We do rotate through CHOP, Children's Hospital of Pennsylvania. Einstein Montgomery is a newer facility, and we do some outpatient activities there. MossRehab at Center One is an outpatient satellite in the neighborhood, and the MossRehab Institute for Brain Health, which is a stone's throw away from the Elkins Park campus. So just a little bit about the medical center in general. Einstein Medical Center is huge. It's the largest independent medical center in Philly, and it's a huge tertiary care teaching hospital, 548 beds. I'm bringing that up because we do have 5 internal medicine prelim positions available for PGY 1 year for our residents. Rotations in PGY 2 year, this is pretty standard. Our program is really pyramidal, sort of like every other, I think, PM&R residency program, with a lot of the inpatient rotations happening in the PGY 2 year. So spinal cord stroke, brain, some TBI, some acute care consults. We do have a month of outpatient clinics to sort of break up the monotony of the inpatient year during PGY 2 year. We were able to figure out how to do that this year, which we're really excited about because we just really wanted to give our PGY 2s a little bit of a break. PGY 3 rotations, there's a dedicated inpatient brain injury rotation during PGY 3 year, but there's lots of outpatient work during PGY 3 year as well, including rotations through the gait and motor control lab. And then there's EMG, pediatrics, and some musculoskeletal outpatient clinics as well. And in PGY 4 year, it's mostly outpatient work, a lot of sports and spine, musculoskeletal, interventional spine, spasticity management, and other outpatient clinics. You'll also have a chance to rotate with a cohort through the residential brain injury program at the MossRehab Institute for Brain Health. This is just a little a map because I thought this would be helpful just to give you a sense of kind of the layout. And like I said, for the bulk of your time in residency, you'll be spending your time at MossRehab Elkins Park. This map doesn't have the Moss Institute for Brain Health because it's like too new, but it's about a 10-minute drive from MossRehab at Elkins Park. So our didactics are, we have a didactics half day, dedicated half day from 8 to noon. It's at Elkins Park campus, but if you're doing an off-site rotation or something like that, you can Zoom in. We try to keep it really high yield, and we have a faculty-driven didactics program. So, you know, not a lot of resident-driven didactics. There's lots of time for you guys to teach each other on the wards. This time that you have on Wednesday mornings is protected educational time. The attending physicians will cover the inpatient services during this time, and for Wednesdays, they will write all the progress notes for the service. There's also a sports and spine lecture series, which happens from 7 a.m. to 8 a.m. on Tuesday mornings. And it is held in person, but there's the option to join it on Zoom if you are not near Elkins Park. If you Zoom in, though, you don't get donuts and coffee. So these are just like our didactics curriculum was revamped this year. As soon as I stepped in as PD, I convened like a group of faculty and residents to create a didactic curriculum committee, and we really sat down and mapped out the high yield topics and the number of hours of lecture we have in a 12-month period, And we really revamped the didactics programming this year. I'm really excited about that. There are also some citywide training courses that we get involved in. So the major PM&R residency programs in the Philly area do collaborate and get together for these citywide training programs. So Moss hosts the gait and orthotics course, of course. And then there's an electrodiagnostics and neurophysiology course that's hosted by Jefferson. There's also an anatomy course hosted by Jefferson that we do. I'll get to that in a second. And then there's a prosthetic course at UPenn. So we do all of these as part of our didactic curriculum. The anatomy course is actually like a couple months. It's pretty comprehensive. And what's really nice, I'll go back for a second. Dr. Plesteris, who runs the Sports and Spine Conference series, he actually mapped it so that it matches the anatomy curriculum. And so like whatever, part of the body you guys are learning about in anatomy that week is going to be focused upon in the Sports and Spine Conference. So that's pretty cool. Shifting gears a little bit, vacation days, again, pretty standard. There's 20 days of vacation per year, usually taken a week at a time. Call coverage is in-house. It's front-loaded, so you do more call when you're a PGY2. And so the average as a PGY2 is about 3 days out of the month, and then that drops down to 1 to 2 in the third year, and fourth year, it's about 1 every 2 months. And it might vary a little bit depending on what rotation you're on. In terms of resident wellness, I know that probably every PD says this, but I really mean it. We take the duty hours and resident fatigue really, really seriously. Those rules are there for a reason, and I believe in the spirit of those rules. So we try to foster an environment where residents support one another, like, hey man, you look really tired, why don't you go home? And where they feel supported by faculty as well. We have an excellent track record within our institution of complying with duty hours, and I intend to keep it that way. I mean, I don't think we come anywhere near close to violating duty hours, but anyway, most PM&R programs don't. The PD, which is me, and the associate program director have an open door policy. And there's lots of opportunities to do extra fun things outside of residency. I'll show you a little bit about that. Every resident's also assigned a faculty mentor. So we have a couple fun things. This is Camp Independence, which is a camp that we run every summer for folks who want to participate in that. And the residents do get to volunteer a shift covering Camp Independence. The shifts are 24 hours, you get to bunk out, and we cover your clinical service while you're volunteering at Camp Independence. This is also a really cool event. This is down the shore in Wildwood. This is the They Will Surf Again event, where basically we take people out on surfboards. It's pretty amazing. So it's really a fun event that people can participate in. This is kind of like a list of our faculty, and this is part of what makes Moss really special. These are people that I just absolutely love working with, and like so many folks here that I just adore. A lot of these are Moss graduates too. So many of our faculty trained at Moss. We have MossRehab Research Institute, which I talked a little bit about earlier. It is basically in the building next door to the Elkins Park campus. And there is a lot of availability to get involved with research at the Research Institute. It's pretty neat. We also have a lot of robotic assisted rehabilitation at Moss. We have the biggest program in the nation with lots of cool gadgets, if that's what you're into. And there are also lots of MRI sponsored lectures and conferences throughout the academic year, not necessarily geared toward residents. Some of them are geared toward other rehab professionals, or geared toward faculty, but some of them are really interesting, and you can certainly, your residents are certainly welcome to attend. These are some of the laboratories at MRRI. And this is Bailey, our wonderful therapy dog at Moss. Thank you so much. I think I left you guys enough time to ask questions. I talked a little bit too long. Let me see in the chat. What do we have here? It's somebody's asking if students and applicants are allowed to attend. If you email me, I can get you some links to some virtual didactics. And yes, students are able to rotate through our program. You can contact us for more information about that. The pediatric rotation is a 2-month rotation. In the PGY 3-year, it is at CHOP, and it's a combination of inpatient and outpatient experiences there. There's also some elective time available both in the 3 and 4 year. If somebody's interested in pediatrics, there are opportunities to do more elective time there as well.
All right. Thank you so much, Dr. Siegel. If you'd like to, you're welcome to hang back and answer any additional questions that come through the chat. And if you want to include your contact information, feel free to do so.